An outlandish rumour which has been circulating for years has resurfaced following Prince Harry and Meghan Markle's Netflix docuseries and Harry's memoir Spare. This rumour alleges that Markle used a surrogate to deliver her children with Harry, and in some cases it maintains that her kids are non-existent. A Redditor, who's a nurse practitioner, has proven that Meghan used a surrogate. The netizen wrote, "I think I've finally figured out why Meghan, during her pregnancy with Archie, was unable to get the help that she needed when battling depression to the point of suicide. It links to my suspicion that Archie was a surrogate pregnancy. I'm a nurse practitioner in Los Angeles who prescribes and treats patients in the US, so please correct me if it's totally different in the UK. I'm going by what I read on the NHS guidelines online. I'm not convinced that Meghan saw an obstetrician for her first pregnancy with Archie, and I'm therefore convinced Archie was a surrogate. There was zero mention of medical treatment in any interview, article or book that I've read about her so-called pregnancy. In the US, we screen our pregnant patients with PHQ-9 for depression. I know this is done in obstetrics in the UK. I believe physicians use the NICE guidelines for mood disorders as a part of their psychological assessment in pregnancy. During her 9 months of pregnancy, Meghan instead went to HR and didn't get psychologically screened by her obstetrician. These people are supposed to routinely ask about these symptoms at antenatal visits, or a psychiatrist for her to get help, or a primary care doctor at least, not with any physician regarding her mental health. Physicians know how serious mood disorders in the perinatal period are, and how they have so many risks on mother and baby. This is tackled with treatment as soon as possible. With severe depression and with a plan for suicide, patients are placed on psychiatric holds or can be placed in a psychiatric rehabilitation clinic. Moreover, in the Oprah interview, Meghan informed her that she went to HR for help, not an obstetrician or psychiatrist. Sounds like Meghan wanted to get help by going to a rehab facility, but probably got denied by HR since that's not something that's done by the institution, and likely was referred back to her obstetrician since it's organised with physician's orders. I can deduct from this that if Archie was a surrogate, she couldn't be routinely seen by an obstetrician for a solid treatment plan, couldn't tell HR about the surrogacy, and felt like there was no other choice but to go to HR instead. Many people don't trust Meghan Markle. They are sure that she only wants to attract attention and sink the monarchy, but there's also a section of the public that supports her, especially some linked to the already deceased Diana, Prince of Wales. In response to the post, one said, "My theory is that whether she was pregnant or not, she went to HR because HR was getting complaints about her bullying, and she informed them that she was the real victim. If she just wanted a therapist or psychiatrist, she could have easily gone to any specialist she wanted. No one would have stopped her. It wouldn't have to be public information. A specialist could visit her at home and no one would know." A year before all that pregnant, Catherine was going to therapy along with the family in connection with her brother's depression. No one stopped her or tried to hide it. Agreeing, another commented, "That's an excellent theory." Regarding treatment, in the Oprah interview, she said she wanted to go somewhere, allowing the audience to infer that she meant inpatient treatment at a mental health facility. There's a rumour that she actually wanted to go to a holistic rehab centre on a tropical island, owned by one of her friends, which might also have possibly been yet another advertising opportunity. I think it's plausible.